pterygopalatine fossa is here. Remember we talked about how it was behind the orbit and down, and a little bit lateral to the nasal cavity. This is the nasal cavity in here. So this is the ganglion. This is the nerve of the pterygoid canal coming in, and back there you can see that metallic looking thing is the cranial nerve V2. So V2 goes through rotundum and ends up in the pterygopalatine fossa. So the story is that the greater petrosal nerve, which is the orange one, and it's a branch of 7, meets up with the green nerve, which is the postganglionic sympathetics on the artery, the internal carotid artery. So these are postganglionic sympathetics. These are preganglionic parasympathetics. And they meet and go into the opening of the pterygoid canal, which is right there, which you can also see on here. So this, is the sphenoid bone just pulled out. So the opening of the pterygoid canal is right there. So those two nerves combine and form the nerve of the pterygoid canal. And they go in there, which is also the anterior wall of foramen lacerum. So this is foramen lacerum, and remember, nothing goes through there. So the opening is inside foramen lacerum, but in the anterior wall. And when it comes out the other end, it's right here in the pterygopalatine fossa. And then the preganglionic parasympathetic fibers that were in the orange nerve now synapse in the ganglion and become postganglionic. And the ones we're interested in are the ones that then jump on to, they go to the infraorbital nerve and then to the zygomatic nerve and then to the communicating branch that go up to the lacrimal.
Yeah, wow.
I know.
That all 5 times.
I'm all studying.
I know. I traced it out yesterday. I wrote it all out here.
All that.
And I demonstrated it. It's also here. So, the take-home message is they're preganglionic parasympathetic fibers in a nerve called the greater petrosal nerve, which is a branch of cranial nerve 7. It carries preganglionic parasympathetic fibers that meets the deep petrosal nerve, which are postganglionic sympathetics. Together they become the nerve of the pterygoid canal. They go into the pterygoid canal, and when they come out the other end, they're in the pterygopalatine fossa, where the preganglionic parasympathetic fibers synapse in the ganglion and then get distributed to branches of the maxillary. And you remember one main branch of the maxillary is the infraorbital, another one is the zygomatic. So the postganglionic parasympathetic fibers that go with the zygomatic nerve transfer, it's easier to see it on here, transfer from the zygomatic nerve through a communicating branch to the lacrimal nerve, and they get dumped off in the lacrimal gland and cause it to secrete.
Got it.
No problem.